This international children's charity is dedicated to carrying out reconstructive surgical procedures, mainly cleft lip and palate, on babies, young children and some adults, in developing countries that have limited resources. Patients travel from all over Pakistan to the Cleft Hospital in Gujrat, a purpose-built hospital founded by the Bashir family, hoping to get advice and treatment from the specialist UK surgical team. In Pakistan, the incidence of cleft lip and palate and other facial deformities is significantly higher than in the UK. Research is currently underway to try to identify why there's such a high number of these cases in some developing countries.
The main factor is the genetic one, we think. There is some problem with the genes, and that's why the middle of the face doesn't develop properly. And it can be associated with other deformities like the hands and the feet and the brain and things like that.
The volume of clefts in Pakistan is huge, and fixing them is only the beginning. You need all the other pieces. You need orthodontics, you need speech therapy, psychology, and without all of those, there is little point in just fixing the cleft.
The medical team from the UK for each visit includes at least 2 consultant plastic surgeons who specialise in facial deformities, a consultant anaesthetist who specialises in children and babies, and theatre nurses and the rest of the operating team. In Pakistan, there's a core team of theatre, recovery and ward staff, and additional medical and surgical support personnel who readily give up their time to help the visitors from Britain. Everything's ready to start to operate surgery. This work restores the ability to breathe, speak and eat correctly. But more importantly, it puts a smile back on the face of children and helps them to integrate more fully into society.
The need of help from abroad, that's why we started this work. The idea is to complete the repair or the treatment before child starts speaking, so that the speech can develop properly. If they need help, then that's provided in this hospital.
Unless you work in this specialized area, you may never have seen uncorrected cleft lip or other facial deformity.
People take their appearance for granted. Most of us do. And I think to have a disfigurement, which a cleft is if it remains unrepaired, is a tragedy. It is not something that anyone in the UK would expect to have to live with. And why should people in any country in the world expect to have to live with that?
With no opportunity for children to have this necessary, often life-saving surgery, they often go untreated and have difficulty learning to speak, often unable to attend school. And they're ostracized from society, a lifetime burden for them and their families.
I have spoken to so many mothers. They ask me, why it happened to me? Why is my child like this?
He is born with this defect. Why can't we help him to get the best possible treatment?
It's no one's fault or choice if you are born with a big malformation, but yet society will segregate these people for being different and isolate them, and that is an extremely difficult existence for them. You need to do your best to try and help them and integrate into society. I suppose emotionally difficult aspect of this is that many of these children will come to you age 10, 15, or maybe even 20 years of age, and you understand that they must have lived in social isolation during all that time.
In the second part of the week, the OPSA team and the Cleft Hospital receive a special visit. The President of Kashmir has come to the hospital to learn more about their work. Since his visit, the head of the Gujrat hospital, Dr. Ijaz, has been to Kashmir at the President's direct invitation and made plans for an outreach cleft clinic, as the Kashmir region has no such services available for impoverished people. And it's anticipated that this service will be developed further over time. Trustees and volunteers are dedicated to training and empowering local doctors and other healthcare professionals to become self-sufficient within their communities over time. Trainee cleft surgeons and maxillofacial surgeons from the UK come on the trips now, at their own expense, for the chance to learn and develop such specialist skills.
It's amazing what this small team can bring and do for this big problem.
Once they've had that surgery, this will give the children and their families by default a confidence, and a confidence to go forward, to move forward in their lives. The more people know about it, the greater the awareness, the greater chance that more children will benefit from the service. So it's important, that raising awareness is important.
There's a continuing and enormous demand for this surgery.